Hi, everybody, and welcome to the Just a Person podcast, a show that explores life's highs, lows, and in betweens. I'm Madison, and this week I sat down with Sarah. We talked about why she became a therapist, what holds people back from going to therapy, and why she thinks it's important. Thanks so much for listening, and enjoy the episode. Hi, Sarah.
Hello, Madison.
Welcome back to your third round. You are a regular at this point, I think.
It's like I'm a rock star or something. I don't know.
Like I'm a rock star. Are people banging down your door saying Sarah, Sarah?
Yeah.
What is the word? It's like not your social status, but maybe it's like similar, but you're climbing the social ladder.
I mean, I think at this point you can just call me like Hannah Montana.
Okay, we'll do it. All right, I'm gonna ask you the question now. Are you ready?
Yes.
The question from the hat, trusty High School Musical hat.
Ooh.
And I will say it has, oh, I thought it had the whole cast. It only has Troy and Gabriella, so never mind.
Oh, come on.
I thought that was gonna be cool for a second, but I'm wrong. Okay. Ooh, what's your worst habit?
Oh my gosh.
I don't even know. I feel like I have a lot of bad habits.
That's what I was gonna say. I have a lot. Recently, the one that I've been catching myself is when I can't sleep, I'm doing late night online shopping.
No. No. That's tragic.
Like just buying random things that I don't need. And then I get a package and I'm like, what did I even order? So it's like a surprise, but it's like rewarding, but I don't know. It's bad for my bank.
What do you like? Are you shopping on Amazon or are you just shopping on websites?
Oh, everywhere. Amazon, like American Eagle, just anywhere. Like recently, you want to know what I bought recently?
Please share.
So I I bought one of the, have you seen like the alarm clocks that mimic like a sunrise?
Yeah, my brother actually has one of those. Yeah.
Okay, so I'm not alone.
No.
I bought one of those because I cannot get up in the morning.
Have you tried it?
Yeah, it doesn't really work because I just lay in bed until it
Okay.
goes off.
Yeah. So it's the same as a regular alarm clock then.
Yeah, and I have it like set up in the corner of my room so like the light will wake me up, but I'm too lazy to get out of bed to go turn it off. So,
See, I use the alarm clock on my phone and I did that in college too, but then it got to the point where I just would in my sleep turn it off and I would then wake up like 3 hours after I was supposed to get up. So I had to buy a real alarm clock and then put it on the other side of the room. So that way I had to get up to shut it off. Otherwise, sometimes you just literally turn it off in your sleep and you don't even know.
yeah, that's happened to me a few times.
Well, I don't think it's that weird that you bought it, but I do see how it wouldn't work.
Yes.
It was a good try though.
Yeah. So, what's your worst habit?
I'm trying to think of what it would be. I mean, I do bite my nails sometimes. I'll say it. But I think probably overall, I'm kind of just messy. I'm just like a bit unorganized. Um, and then I do kind of have the habit of when I go places, mostly, well, just my family, but I hate wearing socks. So sometimes when I go to people's houses, I take off my socks. But my brother told me that that's weird, so I had to stop. So I don't do that as much anymore, but I'll do that if I'm at like my someone in my family's house. If I'm gonna be there for a while, I'll just take off my socks and put them in my shoes.
Stop.
Because I hate having stuff on my feet. It like bothers me. So probably that. That's probably my weirdest habit, but I don't do that at people's houses that are not in my family.
Okay, fair.
And I don't do it nearly as much as I used to because I got yelled at. So
I was trying to think the couple times that you've been over my house, you haven't.
taking my socks off,
Yeah.
I wouldn't do that. Unless I was spending the night somewhere, then I would take off my socks probably.
Well, yeah. Yeah.
It's just kind of a weird habit. I don't know. I don't know. Maybe that bothers people. And maybe some other people do that. Sometimes people just don't even wear shoes. They just walk around barefoot.
I do know people who take their socks off.
See?
Yes. Like what you were, like everyone takes socks off, yes, but like in certain places or yeah, I do know people.
It just bothers me to wear things. I've never liked socks. I used to get yelled at because I would leave my socks all over our house and then they would just lay there because I didn't want to wear them. But it's like immediately when I get home, I had to take off my socks. I hate wearing socks.
Interesting.
I know. So that's something you learned about me today. Congratulations.
Yeah, yeah.
I'm sure everybody wanted to know that, especially since a lot of people are grossed out by feet. So I'm sure they'll be glad to know that.
Yeah.
Okay, switching to something else so we can stop talking about that. Uh, so today we're talking about therapy. Woo!
Woo woo.
All right. First question for you, Sarah. Why did you decide to become a therapist?
Well, my degree is in social work, and with social work, you can go into many different career paths. And when I was doing my schooling in my master's program, we had like a very clinical direct pathway. So it was more geared towards doing therapy. And I absolutely loved it. I loved dealing with different complexities and mental health concerns and issues. And it would just like intrigue me, especially when we would go over what's called the Diagnostic Statistical Manual, which is the DSM for diagnosing anyone. And I was just so intrigued. I was like, I want to work with this population. So it just, I don't know, it really, I love doing the classes and being able to interview like my professors and other classmates. And it caught my attention.
Now that how long have you been working as a therapist?
Um, it was just a year, no, about a year and a half.
Okay. So, what do you see as like the purpose of therapy, or is there a reason why most people go, or is it all kind of different?
It's all kind of different. So I work at a local community mental health, and we see the most severely and persistently mentally ill folks. So they're like really struggling. Most of the time, it's because they're either on a court order where the court orders them to go to therapy for like anger issues or defiance or, focusing on substance use, anything like that. Then there's, of course, you've got the parents who think their kids need therapy because they're acting out in school and at home and things like that. And then you just have the regular folks who just need kind of like an outlet and are coming to kind of process things and learn how to manage and cope with their mental illness. So it's like a different variety of people, and I get them all. I like working with some of them, and some of them are very challenging, but I like that challenge. So it just depends on the day.
Okay, so people can come to you from like a court order, or they can just come to you if they want to. Like they can just seek out a place to go and it's like open to the general public.
To a degree, yeah. So like a community mental health is for the most like intense kind of mental illness. So what they have to do, they have to have Medicaid as an insurance. We don't accept private insurance. And they have to meet our requirements. So they have to go, it's like a long process for being able to get accepted into a CMH. And they have to do like their assessment and see if they even are eligible for services. So they go through a lot of questions like evaluations and all of that fun stuff. And then if they meet those requirements, then they'll be placed with either like a case manager or a therapist and go from there and seek their treatment.
Okay, because I think for a lot of people, at least like that I've heard of, don't go because it's kind of different than a doctor because it's like where do you at least like where I'm from there's like two doctors so you just kind of pick one but it's like where I don't even know where you would look for a therapist.
Yeah, and it's especially difficult because where I live is kind of a rural area as well. The options are limited. And I always feel bad when people come in for like an assessment and they have private insurance. And I'm like, hey, sorry, you got to go find an outside provider. And we have like one other outside provider that accepts like private insurance. So half the time they're needing to find someone online, like betterhelp.com or um, there's another one that people use. Or they're like traveling, either an hour or a specific location away so that they can have the resources that they need in order to just seek the services.
Which I'm sure it's tough to have to turn people away just because they don't have the right insurance. Like these people are seeking out help and you just like, I mean, you don't have like the resources to help them.
Well, luckily, I'm not an assessment specialist, so I typically don't have that discussion with them. However, when I do have, we call them consumers, they're my clients, but whenever I have a consumer who, like, say, changes a job or they get a different insurance and it's no longer Medicaid, then I have to have that discussion. I'm like, I'm so sorry. Like, you gotta go find someone else. We can't. It's tough, but it is what it is.
What do you think of the online therapy type thing? Because I've heard a lot of mixed reviews about those. Do you have any thoughts?
Oh, I have lots of thoughts.
Okay.
Um,
That was either the face of someone with no thoughts or many.
it was many. I think it has to be personalized for someone. So if someone, has difficulties, so like if we live in a rural area and there aren't resources available, then yes, seek out online counseling and online help. However, I started my job online because it was in the middle of COVID, and I absolutely cannot stand doing Zoom anymore as therapy. It's just not the same. It's not the same in person because you're not able to read body language. You're not able to have that personal connection with someone. It's just different. And half the time you're telling people to not go to therapy while they're on the toilet. And
What?
it's just like, I personally do not like it. I absolutely hate it. But that's just me. And it's going to be different for everyone. So if online therapy works for you, awesome, seek that out. But if you prefer to do in person, then go that route.
That's an interesting thing about therapy too, is that it does seem like because sometimes people will go, right, and they will have a therapist and it just doesn't fit. And
Hmm.
it's like I think it probably can depend on a lot of things, like your experience, how many years you've been doing it, which sounds the same, but you could be like 60 and just started being a therapist. So like
Hmm.
your age, probably your gender, where you're from, like whatever you're bringing to it from your own life, that affects the way that you treat your patients, I'm sure.
Yeah, for sure. And it's definitely difficult being a new therapist and kind of a younger therapist. So like when I have older consumers, like say in their 50s or 60s, it was something I was self-conscious about. I'm like, I'm really giving therapy to this person who is a lot older than me, who has had probably more life experiences than I ever have. However, it's like, I don't know, it was difficult, especially when I was first starting out. But now it's like, I have a lot more trainings and I'm more competent and confident in providing therapy and the skills and doing that type of thing. So I'm not as self-conscious about it anymore. But it's definitely different being a younger therapist and providing therapy, especially I have lots of parents. I work with kids a lot, and I have lots of parents who say, if you don't have kids, you can't provide any therapy because you don't know. And it's just like, well, true to some extent. However, I'm trained in working with children and adolescents, and it's just like, it's difficult just being a new therapist and being young.
Yeah, yeah. How do you approach that then when you're treating people of all different ages that have very different experiences than you?
Like, how do I deal with it?
How can you like approach that? Are you just doing it based off of like, oh, this person has this and this is how I treat this particular issue? Or like let's say someone was like bipolar or something. You just know, do therapists like learn how to treat certain disorders, or just someone that's going through like a certain situation, like someone like their parent died or something? Do you just know how to treat certain situations, or how does that work?
So typically we base it off on what their behaviors are. So if an individual is struggling with bipolar disorder and they're having, periods of manic episodes, that shows me that they're having a difficult time managing emotions. That's what I'm going to focus on doing and using skills. and therapies that are for regulating emotions. If someone like lost someone close to them or is experiencing death, we'd focus on the grieving process and being able to manage and cope with the different states and stages of grief, as well as, managing emotions and depression, anxiety, and all the different types. So I base it off of what they're currently going through, what their behaviors are, and how we can improve those behaviors so that in the future they have the skills needed to be able to practice them on their own.
So the patients that you see is the goal of therapy, I guess, to eventually not have to go, or is it something you should just keep doing?
Goal of therapy is to definitely get the skills you need and try it on your own and discharge from therapy. Whenever I meet a new client or I have a new person coming to me, that's the very first thing I say. And I'm very honest with my clients. And I'm like, I don't want to see you in here for the rest of your life. Like, yes, therapy may be helpful, especially if someone you're just talking and venting to because you have a therapist who listens and validates you. However, we got to build up those skills so that we can get you to practice them on your own so that I will never see you back in this building again. Yes, we can see you out in the community. That's great, but not back in this building. I don't want to see you there.
Yeah, that makes sense. So I've heard before that like maybe it just depends on the severity of something because I've heard too that like some people that go to therapy just plan on going forever. I don't know if it's the same as like let's say because you have to go to the doctor forever, really. Like you're supposed to go get checkups and stuff. Can it apply in the same way and you're just checking it's just like checking in as opposed to like actively trying to treat something? Or like do people just come back when something starts bothering them again?
I think it depends on the type of therapist you are. So if you're a contracted therapist and doing private therapy, that's different. Because then if I were a private therapist and I was getting paid to just sit and listen to someone vent, of course I'm not going to want to have them go. Like that's money. I'm just sitting there listening. And if it's beneficial for them, shoot, why not? However, I'm not a private therapist. So when I work in a higher intense agency that provides services to those who are really struggling and who are very emotionally dysregulated, and have higher mental illnesses, my goal is so that they can have those skills to get them out of therapy. And then if they do come back, then it's typically, they're, say, like another manic episode and they're not able to control their emotions or they're struggling with another death, then of course they can come back. It just depends on the type of therapist you are. Like I said, if you're a private therapist or if you're working for an agency where the goal is to get them out of that agency.
People also say like you should like you don't have to wait for something to be wrong to go to therapy, but that would probably apply also more to like a private therapist than you. Obviously, it's not going to apply to you because you guys have certain criteria that people have to meet before they can see you, but that's probably uh just general. I mean, most people would go to just a general therapist.
Right. I also think too, like if your therapist isn't challenging you, then is that the right therapist for you? I think a therapist is someone who needs to constantly be challenging you and putting you in uncomfortable positions where you're having to get out of your comfort zone. So if your therapist isn't doing that for you, then in my eyes, it's kind of alarming and it's kind of concerning. Like, does your therapist, are they just comfortable with seeing you as a patient and aren't really going to have you do anything for the rest of your life? So that will make you be in therapy for their lives, if that makes any sense.
Yeah, like you're not like you said you want the people that you see to learn how to change their behavior on their own to make their lives better instead of you just like continuously seeing them but not teaching them how to do better or like how to like fix things, but just kind of letting them just keep come back over and over.
Right. I want them to be able to do the work on their own. Because in therapy, really, it is they're doing the work by themselves. They're doing 98%. I'm doing 2% by giving skills and therapies that I've been trained in and evidence-based practices. So they're doing all the work. It's really up to them.
What have you seen in terms of benefits of therapy for your patients and for yourself? Because I know that you go to therapy. as a therapist, which makes a lot of sense.
I love, so being a therapist, especially in a community mental health setting, is very, very difficult. You get put in a lot of challenging situations. You hear a lot of upsetting things. And sometimes it just bogs you down, for lack of better words. It just puts you kind of like in this depressive state. So I love when a client is successful and is able to successfully discharge from services. And it just makes, I love seeing them happy. Like I recently just closed someone because they had completed their goals and everything. And this individual had said that, I never thought I would be discharging from therapy. No one has ever told me that I could discharge. It was just like a positive thing. And this person, you could just see like the light on their face and the smile. It was just so happy and they felt accomplished and successful. And that's something that I want for everyone. So again, I think it goes back to how much you put into therapy, how much you're willing to change, how much you're willing to be challenged in order to get something out of it.
Is it hard for you? Because you can't just tell people what to do or like give them your own personal opinion of their life. That's not really your job. Is it hard to not do that though?
Sometimes, yeah, especially if it's someone that I've worked with for a long time and we have a good rapport and a good relationship. And I just want to be like, no, don't do that.
Because they're not like your friends. Like you're
Right.
treating them and they're like, they trust you to like, to help them.
Right. Yeah. There's those professional boundaries in place. But in terms of giving like advice or opinions, I really try to stay away from that and use what's called motivational interviewing, of where we're trying to evoke some sort of change topic from that individual. So if someone is saying, I really don't know if I should be friends with this person anymore. What do you think, Sarah? I would be like, well, why is it concerning for you to have my opinion? Like, what about my opinion is going to help you make a decision? I'm not the one in your life right now, or I'm not making the decisions for you, that only you can do that. So kind of like taking a twist on it and putting it back on them to motivate and to kind of give them the focus of, okay, I can do this myself. I can trust myself with what I'm doing and take my own advice, if that makes any sense.
Yeah, like you're not giving them advice, you're asking them questions so they can better think about what they're doing or whatever choice they're making or whatever it is.
Correct. Yeah.
Okay. That makes sense because, yeah, you can't just be like, yeah, you should get rid of all your friends. They're terrible. You
Or,
should
yeah,
dump that guy.
exactly.
Like, that's not really any of your business at the end of the day. It's not your life.
Yeah. Lots of people ask me, should I divorce my husband? And I'm like,
Like, we just met. I don't know.
I'm like, oh boy. So it's difficult. It definitely is. And then you get people who are like, well, I trust you and I trust your opinion. And I'm like, oh crap. Like I get reeled in sometimes too, and I've got to check myself because I'm human. I make mistakes just as much as everyone else. So it's definitely difficult not giving advice.
Do you think that people come to therapy and then think that their problems are going to be fixed, even though the point of therapy is which it is to help you fix your problems, but it's like to make you fix them. They don't just go away.
Oh my gosh, you just like triggered an emotional response in me.
Sorry.
I get this all the time. In fact, it's actually like a running joke I have with my supervisor. I see this a lot when working with kids. Parents will come in, say all the bad things their kid is doing and say fix them. And especially with schools, schools will call us and be like, why aren't you fixing this kid? This kid is yelling in class, is acting out, is, breaking things, fix them. And I'm like, that would be great if I had a magic wand. I could just wave it and poof, everything's fixed. So the inside joke is that my supervisor actually got me like a plastic wand. I have it in my office on my desk. And every time someone or like a parent says, fix my child, like I like bringing humor into things. So I'll be like, yeah, let me just pull out my magic wand here and I'll wave it and poof, everything's fixed.
That's pretty funny, but does it go over well?
I mean, it depends on the situation and the parent.
Hit or miss?
Yeah, if I have a rapport with them or not.
It's actually pretty funny. I like that. Good job.
Thank you. It's just very frustrating when people come in and they don't want to do the work themselves and they're putting everything on my shoulders of saying, fix me or fix my child. It's very, very frustrating.
Yeah, I'm sure. So, what do you think are some reasons that people don't go to therapy or just like misconceptions about therapy?
I think one of the big misconceptions I see is people think like kind of like what you see on TV or in movies of where there's going to be a couch and you can lay down and you have like a head massage and you're talking to your therapist for like an hour and a half and it's like so we don't have couches. We don't have any of that stuff. I'm not for sure not giving you a head massage. That's definitely, I think, one of the misconceptions. But the other one I think ties into what we were talking about earlier is that they expect the therapist to give advice or to make changes for them. And a lot of my people get upset when I won't give them advice or when maybe they hear this thing that they don't want to hear that upsets them. I see that most common. And then also just like therapy is scary in general, especially for someone who's never been. It's very nerve-wracking. You're talking to a stranger who you don't know you can trust.
About the most intimate parts of your life.
Right, exactly. And you don't know what to do. And it's just like very nerve-wracking. And people are like, I don't need a therapist. Therapists are jokes. And it's just, it's very scary. I get it. That's one of the things I say in my spiel when I've got new people, like, therapy is scary. Yeah, it's very nerve-wracking. And I don't know, embrace it. You're going to have tough situations in life. And the only way you're going to be able to face those is to push through them. So why not start with therapy?
Yeah, how do you, when someone comes in for the first time, how do you even start that? You just say that and like, how do you get people to start talking about things?
So typically what I'll do is I'll look over their chart before they come in for their, it's called the first service appointment. So I'll look over their chart briefly, kind of see what's been going on. And then I pull them in and I'm just real with them. I'm like, hey, like I'm just looking for today, just have like a very casual conversation, spilling out the expectations I have for them in therapy, as well as asking them what their expectations are for me. And then from there, it's like getting to know one another. So like I ask them, what do you do in your free time? Or kind of like I think of it as what you would ask a person that you're wanting to be friends with, but having like those boundaries as a therapist versus patient and client, kind of like that. And then I'll weave into, okay, so like you're here for some of these issues that I read in your chart, like you're struggling with anxiety and depression and some trauma. How is that impacting your life? And where would you like to see that from 6 months from now? Like, what's your end goal? And kind of go from there. And then I'll do like either at that first session or the next couple of sessions, I'll say, okay, this is what I think would be the best treatment for you. And here's how I can provide it. And here's how we can get started. And then that's where we go.
Is it we like you're saying you're getting to know each other? What are you like sharing with people?
Typically, I don't really share about myself unless they directly ask. I have like personal boundaries and things like that. Like people ask me my age all the time, and that's something I won't share with them.
16. Be like, how old do I look?
Did I tell you about I had a brother and sister in for services, and it was just them in my room with me, and they were like, Sarah, how old are you? And did I tell you the story?
No.
And they asked me, and I was like, oh, I'm like 58. And they're like, really? And I'm like, yeah, I'm 58. I'm really old. Like, I could be your grandma right now. And they're like, oh my God, you look so young.
That's hilarious. They're like, you look great for your age. Wow. Could you please tell us what your secret is?
No, and then of course I'm like, no, I'm not 58. Typically, when people ask me my age, I like reflect it back in terms of assuming what they're thinking. So I'll be like, so I'm assuming that you're thinking I'm not competent in my role and that I'm not able to be a good therapist. And then that gets a whole conversation started. But, if people ask me about where I'm from or, kind of just like the basic demographics, if I have kids, if I have brothers, sisters, or anything like that, I will share. But if it gets too personal, I'll be like, okay, we've got boundaries.
Start telling people you're like 17, but you're one of those genius kids who went to college when they were 11.
I
And
have used that
you
before.
really?
Yeah, I do it with my little kids who come in and they're like, Miss Sarah, how old are you? And I'm like, oh, I'm like 15. I just told someone that the other day.
Be like, I'm only 3 years older than you.
They're like, really? I'm like, oh yeah, I graduated college when I was like 12 and
Congratulations on being a young genius.
thank you.
Now, why do you think that people should go to therapy of everybody in general? Do you have some thoughts on that?
I just think everyone can benefit from it, whether you're struggling with any mental illness or if you're just struggling in terms of having like motivation, a therapist can help you with any of that stuff, whether it be something really small or something really big. A therapist is a great support system. It's someone that you can go to and trust with some of your deepest, darkest secrets. So I think, like you had mentioned before, I go to therapy myself. It's just something to, I don't know, help me process and work through things, especially when it is so hard being a therapist. I don't know. I'm just very passionate about therapy and having people receive mental health therapy in general. And, whether it's couples counseling or you're going in with your mom or your sister or whatever it is, I just think anyone can really benefit from it.
Before I ask you our final question, the plan is for you to be like a recurring guest. So if people had, right?
Yes,
Okay. I wasn't sure if that caught you off guard, but I was pretty sure we had talked about it. So just wanted to make
I think so.
sure.
I just forgot.
You kind of gave me a look like, okay, did I agree to this? So if anyone has any questions about anything that Sarah could answer, or like some sort of like particular topic we should talk about, in terms of like mental health or treating, I don't know, like a specific thing, what I don't know, whatever. Uh,
Yeah,
let me know. Don't let Sarah know she's not giving you her personal information.
no.
She doesn't trust any of you. So
And I will not be a therapist for you. You have to come in to our service.
if you want to be, if you want to have her as a therapist, you better pay her, is all I'm
Yeah,
saying. Pay her
yeah.
on her own, and it's going to be on your dime. She does not take insurance.
No. And it's under the table, tax free.
Yeah. All right. But yeah, anything, you can let me know. You can send me a message on any of the things that are out there, Facebook, Instagram, my email. Ooh, I'm putting up a website, so there will be a submission
Ooh,
area in that. Um,
ooh.
it will be up at the time that this goes out, but
Okay.
yeah, if you want to, go ahead.
I love talking about therapy. Like I said, I'm very passionate about it. So I'm a therapy nerd.
What does that
So
mean?
I just love therapy. Like I'm wanting to learn more. Like I'm trained in so many things and I just love talking about it. And it's just something I'm passionate about. So I can spend like hours and hours talking about dialectical behavioral therapy. So
Perfect. If anyone wants to know about dialectical behavioral therapy, let me know and we'll do an episode. We'll talk for hours and hours. Okay. My last question. Do you have advice for people going to therapy for the first time?
I think just giving yourself some credit, first recognizing that if you do need therapy, that is a huge step of saying, hey, I think I might need therapy. I might benefit from it. That in itself is big. So giving yourself credit for that and validating yourself of saying, okay, I may be struggling right now and I could really use some support. It's okay for me to seek guidance and services that will help benefit me. Accepting the difficult emotions and being open to new ideas and just really throwing yourself fully into therapy. I love working with clients who are very motivated to change. It just makes my job so rewarding. So, and I'm sure it's rewarding for the clients who receive the benefits. So, just going in with an open mind, validating yourself, knowing that therapy is hard, that times and sessions will be very hard. Sometimes you might be upset at your therapist, but just recognizing it and just continuing to trudge forth. I don't know. That's the thing I always tell my clients, and I'm just big on validating them in terms of saying it is hard and let's work to get you through this so that we can give you the best quality of life.
Very nice. Thank you for being on here for a third time. You're gonna be here forever. You're trapped.
Good. I like it.
Good. I need more fans.
Yeah, I mean, I am Hannah Montana. Come on.
Now, Hannah Montana directly competes with Wizards of Waverly Place. And that's Selena Gomez, and I know that's really near and dear to your heart. So before the next episode, you're just gonna really need to think about your words and your choices.
Okay. Okay. In the spirit of Hannah Montana and in therapy, nobody's perfect.
Oh, okay. Well, that's tough. Now you just made the decision so much harder.
Hmm.
All right, Sarah, thank you for coming back, and we'll see you again next time.
Thank you.
Thanks so much again to Sarah for being on the show this week. If you have a story you want to personally share on the show, want to be read on air, or a topic you'd like to see discussed, find us on Instagram and Facebook at JustAPersonPod, or send us an email at justapersonpod@gmail.com. And we'll see you next Monday with another new episode.